The White House physician gave President Trump a pretty clean bill of health. In fact, he called his overall condition excellent. But he did say the president needs to lose some weight, eat a better diet, and exercise. And there is some debate about whether the president has heart disease. So our own chief medical correspondent, Dr. Sanjay Gupta, explained the numbers flat out show the president has heart disease. And the White House today, though, standing by the doctor's report.
Dr. Jackson has been a White House physician for the last 12 years, trusted by Presidents Bush, President Obama, and now President Trump. He is the only doctor that has weighed in on this matter, that has actually examined the president. And so I think a doctor that has spent the amount of time with the president, as Dr. Jackson has, is not only the most qualified, but the only credible source when it comes to diagnosing any health concerns. And we support what he said yesterday 100%, that the president is in excellent health.
And Dr. Gupta just responded to the White House a moment ago here on CNN, standing by what the numbers show. So I want to talk about the other part of the physical, this cognitive test, the one the president requested. With me now, Dr. Jeffrey Lieberman, chair of psychiatry at Columbia University Medical Center. And so nice to have you on, sir. Just focusing on cognitive, and we'll get into neurological and mental health in just a second. But when we hear Dr. Jackson saying that the president scored a 30 out of 30 on this cognitive test, give me examples of what a cognitive test is.
Well, this assessment was added to what would be the routine battery of assessments that presidents go through annually. And this was added presumably to quell or address the concerns that have been raised about the president's behavior and his mental competence.
Specific questions in the test. Well, give me examples.
This is a very kind of cursory, simple assessment of a person's cognitive functions, meaning ability to pay attention, ability to concentrate, ability to remember things, and the ability to make kind of decisions about the similarities between objects. It's very routine.
So what would it be? Something as simple as 2 + 2 = 4, or Mr. President?
Yes, or what do an apple and an orange have in common? Can you remember these 5 words? Give me 10 words that begin with the letter F. So these are simple things that are a reasonable but relatively superficial evaluation of cognition. But the president passed and has a clean bill of health on that. What I would have liked to have seen, if there's any suspicion, as I'm sure there is, about his mental status, is to go a little bit further, which could have easily been done. That could have been done by doing an MRI. If you look at the report of the exam, the president had 5 different procedures that are different to the physical exam. He had a chest CT, CAT scan. He had an EKG. He had a stress echocardiogram, and then he had also an exercise stress echocardiogram on his heart. So all this emphasis, and then a colonoscopy, all this emphasis on the heart. What about the brain?
What about the brain? And so that's what you say. There should be more, not only whether it's this president or other presidents, but once a year, the president should have to go in and not just have a physical, but the brain, neuro, be tested.
Well, to change the goalposts in the middle of his presidential term is a little unfair, but to be, on the other hand, he's calling the question was his behavior. But it can be used constructively to develop a procedure in which there is a comprehensive evaluation of presidents on coming into office and annually.
But that said, Dr. Lieberman, when you wrote in the New York Times, maybe Trump is not mentally ill, maybe he's just a jerk. You were, calling out some members in your field and saying, let's not armchair diagnose him because none of us have actually, treated him. So stop doing that. But in the meantime, you're saying maybe he's just a jerk.
Well, that's my right as a citizen. For First Amendment, I can express my opinions about somebody, but I'm not doing it as a doctor saying there's no medical diagnosis of jerk and that jerk is a condition that disqualifies you from holding office. The problem is that there is not a procedure that's in place to evaluate not just the body from the neck down, but also from the neck up in our presidents, and the 25th Amendment hasn't been developed in a way that allows it to be called into, invoked if there is serious concern. But it also reflects one other thing, which is the reason why I've gotten involved in this, because I'm just the, scientist, clinician. I'm not the journalist or politician. Psychiatry historically has had a checkered history. It's had a number of problems in which it's been exploited by governments for political purposes. Soviet Union repressed dissidents by giving them mental diagnoses. People's Republic of China, religious groups like Falun Gong.
Okay.
And also, in this country, until the 1970s, a relative could have their family member committed because they say they're crazy, and the doctor, agrees with them. In the 1970s, it became a different standard, and psychiatry is at risk for being exploited, and we can't allow that to happen.
Okay. Listening to you. Hopefully lots of other people are listening to you, Dr. Jeffrey Lieberman. Thank you so much. Appreciate you.
My pleasure.